All right, everyone, we will go ahead and get started. Thank you for joining us for Hood College's COVID-19 vaccine community conversation. My name is Amanda Rzepkowski, and I serve as the Director of Wellness here at Hood College. And I'm joined by Lisa Bromfield. Lisa is a nurse, and she also has her Master's of Nursing. Is that correct?
That's correct.
Okay, she has her Master's of Nursing, and she serves as a nurse liaison for Frederick Health here in Frederick, Maryland. And she's going to be answering some of our questions related to COVID-19 vaccines and just what the public health perspective on vaccines is in general. Lisa has provided education and support for infection control in previous positions, and now she also is serving to educate the community on COVID-19 vaccines, and we're very excited to have her here with us this evening. I do want to share that for any incoming or returning Hood College students, Hood College has required the vaccine, the COVID-19 vaccine, for all students who will be registered and attending classes in the fall. And you can report your vaccine status and find out more about the requirement on Hood College's COVID-19 webpage. And so with that, I'm going to turn it over to Lisa, and Lisa's going to have a short presentation and answer any questions that you all might put into the chat, and we'll answer those live as well in the next 30 to 45 minutes. So Lisa.
Thanks, Amanda. It's good to be here. You mentioned a little bit about my background, so I won't spend a whole lot of time on that. I used to be the Director of Care Coordination that includes infection control at a community health center in West Virginia through parts of the pandemic, so I've had a lot of experience with managing how to help employees get safely through a pandemic and keep our patients safe. And I've also, now I'm working mostly with long-term care facilities in Frederick, but also with the health department, which has done a fabulous job, by the way, of getting people vaccinated, getting people tested, and also educating people. So that's the main point of tonight. I also used to be a special education teacher, and I threw that in because I also wanted to say, so what about my background? Because I know that this is a big decision. Some people didn't find it to be a difficult decision. Some people are finding it to be a very difficult decision. And so my credentials maybe are not as important as what we talk about tonight in terms of you thinking about your reservations, your concerns, and maybe thinking about some new ways to look at it and some new ways to find information that will help you feel good about this choice that you have to make, which maybe doesn't feel quite so much like a choice if it's mandated. It's also mandated at Frederick Health where I work. So I understand that sense of, well, it's a choice, but it's not a choice. I am vaccinated, and my 20-year-old son, who is also vaccinated, just for clear the air there. So really my intent today is to provide you some perspectives for analyzing your concerns, and also to provide you some information about some common concerns. I'm sure that some of the concerns you have are concerns that your colleagues that will have also, and also to encourage you to seek answers for your specific concerns. But first, I am an infection control nurse, so I just have to throw in that the reason we're concerned about all this is because COVID is airborne. So unlike some diseases that you catch by touching somebody's body fluids, which you can from this, but you can also get it by breathing. That's the big deal. That's why it's such a problem. COVID is carried in spit, mucus, and respiration. And what I mean by respiration is that there's small bits and big bits of saliva and mucus that come out of your body. And whenever you breathe, you expire small, tiny droplets, and COVID can be on those tiny droplets. And that's what can stay in the air for a while. That's why it can spread so easily. So it can actually stay up in the air for about 4 hours. If you have really good ventilation, it's not that bad, but it can be up for 4 hours. So ventilation helps dilute. So if you're in a situation and you're unvaccinated with other unvaccinated people, this is why being outside is so good. You can't be more dilute than outside. And if you're inside, if you have windows open, doors open, all of that helps. So one way to think about ventilation and how that's helpful is if you think about if you were in would you rather be with 10 mosquitoes in a small bathroom or in a gymnasium? So your chances of getting bit by a mosquito in a small bathroom are much greater than if you're in a large gymnasium. Or perhaps would you like to be with a dirty diaper in a small bathroom or a big gymnasium? So same idea is that the large space and lots more air helps. Amount of exposure time is also meaningful, so you want to keep those times when lots of unvaccinated people are close together to a minimum. And then just real briefly, COVID is propelled 6 to 27 feet with respiration and coughing, and some things are worse than other things in terms of activities. It can happen if you're symptomatic or asymptomatic. It's about 6 feet when you're talking and about 27 feet when you're singing. So if you're unvaccinated, not a great idea to be singing around other people. Laughing, I figure if you're a loud laugher, that's got to be about as bad as singing. But I'm not sure. I haven't done the research on that. So anyway, on to perspectives. We're going to talk a little bit about the public health perspective, and that includes the economy and the healthcare system. And we're also going to talk a little bit about the variants, which I'm sure you've heard a lot about lately, and also a little bit about sources and experts. So as far as the public health perspective, I think that we have not necessarily done a great job of explaining a public health perspective and really acknowledging to people, yes, there are risks when you take a vaccine, just like there are risks when you take a new medication. So if you are prescribed a new medication, your provider might say to you, if you have this, this, or this, give me a call, because that's a known side effect of this medication. So there's always a risk when you take something new, and that includes vaccines. The public health perspective is that if it only affects a few people poorly, but it saves a whole bunch of people from a bad outcome, such as being hospitalized or having permanent damage or dying, that as a society, we make a decision about whether or not we want to take that risk. So that's the health perspective in terms of what the risk involved is. Public health promotes and protects the health of people and the communities where they live, work, and play. So it's a broad view. And that's where the economy comes in, is that if the economy suffers, that's another way that a pandemic can impact people's lives, even people who are not as likely to be poorly impacted in terms of their health. And this is applicable to many circles that you operate in, your family, your classmates, your colleagues, and it also applies to those with and without chronic disease. We know that folks with chronic disease have been more heavily impacted. We also know that people in some minority communities have been more heavily impacted. And some of that is tied to chronic disease and some of that is tied to other social determinants of health. But that's the public health perspective for one leg, if you will. And then there's a health system problem. So you may have seen video of hospitals that were overrun with people and they didn't have enough room and they're putting people in hallways. And I can tell you that having worked as an ER nurse, this is your worst nightmare to have people in hallways because you don't have all the equipment that you have in an exam room in the ER, so you can really be on top of what's going on with somebody and monitor their health. So when hospitals are overrun, besides the problems for the people that are in the hospital, there's also problems with, say that's the moment that somebody in your family has a heart attack and they're trying to go to the hospital because they're having a heart attack and they need to be there. There's just not as many people available to take care of them or as much equipment to take care of them because it's all wrapped up in treating people for the pandemic. So that's another element. If doctors' offices are closed or locked down, then people with chronic diseases don't get seen and kids miss their other vaccinations and wellness and prevention things don't happen. People don't get their colonoscopies, and I know that would make you cry to not get your colonoscopy. Anyway, I'm just kidding. Another element of the public health perspective is that the more transmission of COVID we have, the more possibility there is for variants. So there's good variants and bad variants. There's probably been some variants that have taken some strains of COVID out of the system and we don't have to worry about them anymore. But then there's also been the ones that we have seen that have made the virus more transmissible or more dangerous in terms of outcomes. So that's what we're dealing with right now, unfortunately, with the Delta variant. Luckily, COVID has fewer evolutions or mutations than the flu does. So on to variants just briefly. The level of immunity needed in a community to achieve herd immunity, or the number of people that have to be immune, is affected by how contagious the disease is. You can imagine if a disease is not very contagious, then it's not spreading easily anyway. So you don't need to have a whole bunch of people that are immune in order to keep everyone else safe. But if it spreads really easily, then more people have to be immune to stop it in its tracks, to stop it from infecting them and then them infecting two and two more and two more. The Delta variant is becoming the dominant strain in the US. So this is also not good news because it does seem to have more impact on younger people. With the original, what they call the wild strain of COVID, I always think that's kind of a funny way to refer to it, but there it is, the wild strain, it mostly affected older people. So now we're seeing that more young people are being affected by the Delta variant. So honestly, you might say that this creates an ethical burden on young people to think about what role are they playing, whether they get vaccinated or not. Because young people they generally don't react as badly to illness because they're stronger, they're younger. So do young people contribute to herd immunity by getting vaccinated, even if they feel like they wouldn't get sick themselves? Or if they don't, they might possibly be a vector of spread of the disease. And they could possibly be a channel for the creation of more dangerous variants. So therein lies an ethical burden, an ethical question for young people to consider. So that's the public health perspective. So I want to talk just a little bit about, for you to identify what's your concern and what is a barrier to you to getting a vaccine. Even if you're planning on doing it, I think it would be better for you to come feeling good about it than to be doing it because you really want to go to Hood or you really want to go to the University of Maryland. My son is going to the University of Maryland, and he also got the notice saying this is mandated. He didn't have much chance to not get it anyway because who his mother is. But what are the nature of your concerns? Because that makes it easier to address them. Are your concerns medical? Have you seen things about side effects that concern you? Are the nature of your concerns political? Unfortunately, this has become a political issue. And I'm not saying that's wrong for it to be a political issue for you, but that I think it helps you resolve it for yourself or think about it if you recognize that that's what's going on for you. Is there a social element? That do you have people in your social circle who feel one way or the other that are putting pressure on you to either get a vaccine or not get a vaccine? And is there a historical component to your concerns? Are you a part of a group that has historically been treated pretty badly by our government and particularly by the medical community? And it's a real concern. So once you've identified the nature of your concerns, I would suggest that maybe you match a source that you trust with the nature of your concern. So if your concerns are medical, that you look for reputable sources about the medical issues. That if your concerns are political, you look for reputable sources about any political element that you see to this vaccine campaign. And that you consider the origin of their answer. So, for example, when I worked on a med-surg floor for a while, so people are coming in to have surgery and then they come back after they have their surgery and we take care of them until they're discharged. Sometimes people would come in to the ER and they were having a problem, they were having pain, maybe they were having a gallbladder attack. And they get a little bit of treatment and they come up to the floor because they're thinking they're going to get their gallbladder taken out the next day. Later that night, you come in to check on them and they say, I'm feeling a whole lot better. I'm not sure I want my gallbladder taken out. So, well, this is a valid concern on your part. And we would suggest if you really are concerned about this, maybe you should wait and get a second opinion. And they would often say, from another surgeon? And I would think, well, if you ask a surgeon how to fix a problem, what are they going to say, right? Either they're going to tell you to have surgery or they're going to tell you maybe you don't need surgery and send you to somebody else. But if you go to a chiropractor, they're probably going to want to adjust your spine. If you go to a podiatrist, they're going to look at your feet. You get the idea. If you consider where somebody's coming from when they're sharing what they believe with you. And you might also consider what is their level of expertise in that field. Everybody doesn't have to be an expert to have an opinion, but maybe the opinions of people with a lot of learning and expertise are worth a little more about big decisions like this, or ought to be considered. So that's just a little bit about who you talk to, basically. And then consider your sources. Are your sources that you're using science-based or opinion-based? If they're science-based, they will have links to data and to articles. They're not perfect either. Nobody's perfect, but that would be a science-based source. An opinion-based source is just that, as an opinion. And again, I would urge you to look back at what is the background or expertise of that person whom you're listening to their opinion. Do they present, the person that you're talking to or that you're reading, do they present info from both sides? So if you're looking for a news source and they always project or present only one side of the political aisle, well then likely the information they give you about everything is going to be colored by that. So you might look for a news source that actually does present opinions from both sides of the aisle or from both sides of an issue. And then you might ask yourself, is the source accountable to anyone? So, if somebody gets in trouble for reporting false information, then you know that news organization is interested in the presentation of truthful information. So you can't always find this, but if you find a history of a news organization disciplining reporters for using false information or making stuff up, then at least for a while, that news organization is probably going to be pretty truthful because nobody wants to get fired. It's the same thing when the health department closes down a restaurant. Well, I tell you, when that restaurant opens back up, that is the cleanest restaurant in town. So it's just another way to think about your sources. If you're interested in, you can look up who people think are good sources. I've included this link that you will have access to that lists some good sources. I was pleased to find one that I rely on was on that list. And then if you know people that you consider to be really unbiased and balanced people who can see things from both sides, you might ask them, what news source do you rely on? Or where do you get your information? So should we address some specific medical concerns?
Yeah, I think so. I know
Okay.
we've gotten a lot of questions from students and families about specific concerns, and I shared those with Lisa, and so I'm excited to hear what you have to share with our students and our families.
Okay. So again, there is a reality of risk when you take a new medicine or a vaccine or a procedure. A lot of testing happens first to see what's the level of that risk. And the J&J vaccine is sort of a case study in how that happens. So the response by the CDC came very quickly when it was thought that there might be a link between the J&J vaccine and blood clots. So their response was, let's not give it for a while. Let's look at this. Let's think about it. Let's talk about it. And that's exactly what often happens during trials of new medications or vaccines also. And it did happen. I honestly can't remember which vaccine it was. During the trials, there was a vaccine that they stopped for a while to back up and make sure that what was going on, what they were seeing, was not related or was related to the vaccine. So then they could decide what's the risk balance here. Turns out that it's not a large risk for a blood clot from the J&J vaccine, and that COVID itself carries greater risk of blood clots, much greater risk of blood clots than does the vaccine. And the others have a risk for blood clots also. I don't want to pick on the J&J. So again, it's a risk assessment. It's a numbers game when you're trying to decide, is this worth a risk to me? Older people who live in nursing homes and who were unfortunately dying in large numbers when all this started, for them it was an easy risk assessment, right? I'm going to get the vaccine, and they did in very large numbers. The risk of blood clots from J&J is highest for women under the age of 50. So you might say to yourself, well, I'm a woman under the age of 50. I think I'll get a different vaccine. So that is another option. Pericarditis and myocarditis is probably one that's on a lot of people's minds. There is a very slight risk of getting peri or myocarditis after vaccination. Pericarditis and myocarditis are both inflammation in the area of your heart. Pericarditis is the pericardium, which is the sac around your heart, and myo means your heart muscle. So it's inflammation of the heart, which obviously is not a great thing. But generally what they're finding is that the very small number of and it's mostly young men between 12 and 29 who are experiencing this, have a mild case. It causes some discomfort, sometimes some shortness of breath. Sometimes they're treated with anti-inflammatories. Sometimes they're not treated with anything. With a little rest and time, it goes away. I'm not trying to minimize it because it's still scary, but there have not been a lot of deaths from this, especially when you consider how many people have been vaccinated. So the chance of getting one of these, unfortunately, is quite high with COVID. So somebody who gets COVID is likely to have some pericarditis or myocarditis or other effects to their heart. So this is one of the things that they're looking at. There was a study of student athletes in Ohio who'd had COVID. I think it was Ohio State University. And 15% of those folks that had, and these were athletes, so these are healthy people, that had COVID had damage to their hearts from COVID itself. So the chances are much greater with having COVID than with getting a vaccine. So I think I've said this. This is some quotes from somebody, and you can look at these if you want to see more quotes. You'll be able to look at this. And I do want to put out there that if you get a vaccine and you have symptoms of chest pain or shortness of breath within the week after that you get it, you should see your doctor, but you also should listen to them when they say you should rest, because that's how you get it to go away, and you don't want to exacerbate an inflammation of your heart muscle. So again, this was mostly ages 12 to 29 of males who got the myocarditis. And as a comparison for what COVID can do, if you have 1 million folks a million young men in that age range get their second dose of an mRNA, which would be the Pfizer or the Moderna, that those 1 million doses prevent 11,000 COVID-19 cases, and they prevent 560 hospitalizations, 138 ICU admissions, and 6 deaths. Whereas out of that 1 million, you could expect 39 to 47 myocarditis cases, which would likely all be mild, because the number out of the cases that are not mild is very, very small also. So it's not many. So the point is just that it's more dangerous to get COVID than it is to take the vaccine. Another concern that a lot of young people have voiced is that there were things online about fertility issues being caused by COVID. Many institutions have looked at this and have found no link between fertility problems or pregnancy problems in women vaccinated while pregnant or who became pregnant afterwards. Johns Hopkins and Yale University both have information about this. Their websites are listed in the references to this presentation, so you can look at them yourself if you want. And then from the male side, there hasn't been as much. It's harder you can't study pregnancy in men, but you can study sperm count, which is a generally recognized way to look at fertility for men. And a study at Miami University found no reduction in sperm count post-vaccination. It wasn't a large study, just to be honest, but there is that study. All of these studies are happening too, so I'm sure we'll be hearing more and more about this as time goes by. And you might say, how can you know down the road there won't be problems? I can't promise you anything. I can tell you that historically speaking, we have not seen long-term effects from vaccinations. So most of the time, side effects from vaccines come within a number of weeks. And the really bad ones, like anaphylactic shock, generally come within 20 minutes, which is why when you go and get your flu shot or you go and get a new vaccine, they ask you to hang out for a little while before you get in your car to drive home. So again, it's a risk assessment that you're weighing the risk. We do know that COVID has caused some people long-term problems. There are people who had it at the beginning who are still having problems with breathing, with heart issues, with pain, muscle pain, with any number of things. So I don't know that there's been any fertility problems, but I don't know that we will know that for a long time either in terms of any effect that COVID itself might have on fertility. Another question that Amanda shared with me was, why do you need a COVID vaccine if you had COVID? Because obviously COVID gives you some immunity. So there's a lot of vaccines that require more than one dose. So your immune cells get a message from getting a vaccine, and they create cells in your immune system that remember whatever part of the organism that the vaccine targeted, so that if it enters your body again, they go, oh, hey, remember that guy? We don't like that guy. We got to get that out of here. But sometimes it takes more than one exposure to create a long-lasting effect. You might be able to remember shots that you've had 2 or even 3 of in order to get the desired effect. So there are some diseases that don't give natural immunity at all. So you may have had strep throat a number of times in your life. You may have had, hopefully you haven't had tetanus, but you've probably had more than one shot for tetanus. If you haven't, you need to go get a tetanus shot. Colds are the same way. Some upper respiratory infections don't initiate any immune response at all. Thus, you get them over and over. So there's not really enough data about natural immunity to COVID, the natural immunity being the immunity acquired by having it, to know when it tapers off or how protective it is. So they do know, though, that if you get it, you have more antibodies against COVID after getting a vaccine than you did before getting the vaccine, but you had COVID. So that's a sign that it's helpful. So we don't really know, but that's why it's being required even if you already had COVID. And why would I take an unapproved vaccine? So this vaccine was developed more quickly, and I know that's of concern to a lot of people. Well, there are several reasons it was developed more quickly. One reason is that the mRNA technology was already being developed for other uses. It's been around for a while for cancer treatments and a number of other things. So they sort of had a leg up on, it was just somebody's idea to let's try this as a vaccine. Also, the government said, hey, we won't wait to see if it works. We'll place orders and we'll pay you, basically. So when a pharmaceutical company creates something new, they're taking a bit of a risk. So this was no risk. This was go ahead, give it your all, give us something, and we'll make sure it works before we give it to people, but we'll make sure that you don't go out of business because you tried to help solve this big problem. And then emergency use authorization, which is that temporary authorization that's been granted, was granted after more testing than usually takes place for vaccines. It was in a shorter period of time, but it was in the tens of thousands, 40,000+ people for Pfizer and 30,000+ people for Moderna, and 40,000+ people for J&J. And then we have the continued research of how many people have been vaccinated, and those vaccines started, as a nurse, I got my first vaccine in December of 2020. So nearly 150 million people have been vaccinated in the United States. So we have the data of what happened to all those folks. So we're continuing to gather data about the vaccines. And then the response of the CDC and the FDA to the blood clots and pericarditis, myocarditis shows you that the system is working, that they're paying attention, they're watching what happens, and they're ready to act if they think it needs to be done. But now we've given so many shots, and worldwide there are other numbers in other countries have been vaccinated as well. So I think that's it. Should we check and see if there are any questions before we?
Yes, thank you, Lisa.
Sure.
That was a great presentation. And we also had, we submitted a survey out to folks if they had questions to submit in ahead of time. So I have one of those, and then again, for anybody who's watching, you can always put questions into the chat or the comments, and we can pull those up as well. But one of the questions was, you've talked about, and there's a lot of information about the COVID-19 vaccines are highly effective in preventing hospitalization and illness. And I was wondering if you could speak about how that might compare to other existing vaccines, whether it be the flu vaccine or chickenpox or something else. How effective truly is it when we think about other vaccines? Is it more, less, and maybe why?
Well, when the numbers started coming back from Moderna and Pfizer, people in the scientific community were blown away because they'd not seen those levels of efficacy prior. So I don't have specific numbers for specific diseases, but I can tell you that the flu vaccine ranges from 35%, I think, to in the 60% range of effectiveness. And we're talking 90-95% with the mRNA vaccines. So there's a big difference there. And but those numbers are generally for death or really severe disease. So still get your flu shot. However, these vaccines do appear to be a lot more efficacious than other vaccines that we have dealt with in the past. So it's a good thing in that regard. And actually, more information is coming out now about how long the immunity lasts, and it's looking like it's longer. So maybe we won't have to get boosters in 3-4 months, which would be nice.
Yeah, that would be great.
Yes.
And historically, Hood College has always hosted a flu vaccine clinic on campus, and we're excited to bring that back this year. We took a break from it last year because we didn't want people congregating.
Yeah.
But anyway, that is the plan for next year as well. You spoke about some emerging variants, and you specifically mentioned the Delta variant. And knowing that by the time we come back in August and in September, the Delta variant may be, and likely will be, of highest concern. For our community that will be mostly vaccinated due to our requirement, are there additional precautions that we still need to take as vaccinated individuals while on campus, or for our students who have approved accommodations? Are there additional things that they need to do with knowing that Delta is more transmissible?
Yeah. At this point, what's being shown in the scientific community is that these vaccines protect you from the Delta variant. So they monitor this, though. The way they monitor this is that as the swabs come in to be tested as positive or negative for COVID, they also pick a certain number of them, or if there's certain symptoms that are associated with a variant, then the health department will let all the providers know, if you get somebody with this particular symptom, please let us know, because we'll want to test the genome or the actual genetics to see what's the variant. So they don't test everyone for the variant because it's a big deal test, but they test a random number, and then they can make a guess and say, okay, well, 20% of what we tested is this variant and 30% is this. And so that seems to be what is out in the community. So they watch that, and then they also can see who's been vaccinated and who are people coming in who've been vaccinated, and are they sick? So if somebody who's vaccinated comes in and is sick, they certainly run the genome on that to see if this is something new or if it's something different. And so they keep track of those numbers. And so far, we're not getting people who have been vaccinated getting sick with the Delta variant in any numbers that are of concern. Because again, you have to remember, it's a 95% efficacy for this vaccine. So there are going to be a few individuals who still get COVID, even if they're vaccinated. But the number of deaths is even less. So right now, good hand hygiene is something I'm hoping will come out of this whole thing. You still don't want other things from folks. And if you're unvaccinated and you're with other unvaccinated people, again, it's a good idea to not be singing at each other, to not be in small enclosed places for a long time. If you can help it, if you have a herd immunity, and they're estimating 80%, maybe 85% is what's required. We're not positive. But if you just have a few people who can't get it for medical reasons, you're likely to achieve that level of vaccination. And therefore, those few people are not very likely to be the only two people that give it to each other. Because where are they going to get it? They're surrounded by people who can't carry it because they've been vaccinated. So that's how herd immunity works. So I would never not say don't wash your hands and stuff like that. But there's really nothing extra to do at this point, unless a variant arises that the vaccine does not work against. So, knock on wood, that's not where we end up. And the more people we get vaccinated, the less likely that is. So.
Great. And I will share that we are next Saturday, July 17th, we are hosting a COVID vaccine clinic on campus. We will offer both the Pfizer, which is available to individuals 12 and older, as well as the J&J, which is available for 18 and older. And so those are available not only to Hood students. We're encouraging our Hood students, if you're able to attend and you haven't been vaccinated, to attend. It's really easy, but also to the greater Frederick community as well. So for folks who are not vaccinated, that's another opportunity as well. You can go to the Frederick County Health Department website. It's very easy. They have all the dates and what vaccines being offered. So I would encourage you to check out the Frederick County, Maryland Health Department webpage. Lisa, anything else? Thank you. First of all, thank you so much for your time and so eloquently and creatively putting together this presentation and sharing with us. I thought it was really engaging and it addressed so many issues that we've heard from our students and families, and so we really appreciate your attention to those questions. Anything else that you have to share with us?
Just to say that if you are a member of a community that historically has not been treated well by medicine, people have heard about the Tuskegee experiments, and even locally, people being persecuted because of their skin color by ICE and things of that kind of thing. You might consider finding your experts or your sources within your own community. So, ask leaders in your community, are they getting the vaccine? And if they have, ask them how they made that decision or why they made that decision. Just like some of the other things you've heard, the fertility issue actually started as a rumor on Facebook. And there are other rumors. One rumor is that there are 2 vaccines, one for white people and one for people of color. And you may think that's crazy, but if you're in a group that has, people in your past that were sterilized or, not treated for syphilis, Tuskegee, and any number of things, that doesn't sound so crazy. And I can tell you that having given the vaccine at a lot of clinics at Frederick Health, there's only one. We didn't know when people came in, we didn't know their demographics, we just knew their name. And we just had a little bucket of shots. They'd pull them up in the back and bring you 5 at a time and then bring you 5 more. But I understand that I don't understand. So seek out somebody in your community to talk to about it, especially a leader that maybe has gotten vaccinated, and maybe they can make you feel a little better about it.
Thank you, Lisa,
You're
so
welcome.
much. Thank you, everybody, for joining. This will be recorded and housed on Hood College's Facebook page. So if you'd like to rewatch, to listen to any of Lisa's great points, or if you want to share it with your roommate or a peer, this will be here as well. And just reiterating that for the Hood College vaccine requirement for COVID-19 vaccine, it is due by July 31st. So just knowing that timeline and making sure that you are having those conversations, as Lisa mentioned, doing research, asking questions of your medical provider or trusted leaders in your community. And then as well, you can always reach out to wellness@hood.edu if you have any other questions. Thank you all so much. Thank you, Lisa.
Thank you.